grow old in our mind, but our bodies, they don't. Our body does not understand that concept same way. All right. So, aging increases risk of miscarriage and chromosomal abnormality, e.g., Down syndrome. These are some of the effects of this biological clock on someone's fertility. You don't want to have an abnormal child. So, hence the need for ovarian cryopreservation. So, if you look at this image, you see that a lady as a fetus of 20 weeks old had or has 6 to 7 million oocytes. That's how many eggs ladies had in their mother's womb. But what happens at birth? It drops to 1 to 2 million. And at puberty, around the age of 12, when they start menstruating, it drops further to 300,000 to about 500,000. What is happening? There is a natural cell death called atresia, decline, that is taking place. Hence the need us to have this conversation. At 30 years, you find out that a woman will have about 100,000 eggs in her ovarian reserve. And at age 35, something happens. There is a sharp decline in the quantity, such that before she reaches the age of 40, you have about 25,000 eggs left. And at menopause, 50 to 52 years, about 1,000 eggs that may not be functional. Remember, we didn't say that there's no egg. So it's difficult to say that a woman doesn't have egg, unless of what the anti-malarial hormone is saying and the intrafollicular count when you is also saying. And that explains how Sarah in the Bible saved Isaac at age 90. So what is this ovarian cryopreservation? The steps is the ovarian cryopreservation is the process of freezing and storing eggs or ovarian tissue. So it means that the lady who normally releases 1 egg per month will have to go through a process of IVF, in vitro fertilization, and those eggs that are supposed to be that are recruited for that month, about 5 to 20 eggs, and 1 will develop receptor for hormones that make egg to grow. That 1 will be the one that will be ovulated for that month. But with assisted conception, we give all those recruited eggs the chance of being expressed. So high dose gonadotropins are given, and the woman, produces many eggs which are collected and they are frozen. This ovarian cryopreservation is also developed for women at risk of loss due to age. We said at the age of 35, it begins to decline. Imagine a lady is getting married at the age of 40. The ovarian reserve would have gone further. So those who are at risk of fertility loss due to age, diseases, there are many diseases that will come to that, or treatment. So for instance, a lady has been diagnosed of cancer and needs to go through chemotherapy, and those chemotherapy medications may not selectively just destroy only the cancer cells. They may also be toxic to the ovary. So you want such a woman to do ovarian cryopreservation. Let her go and freeze her eggs first before coming for such a therapy that can destroy her eggs, so that when she's done with her treatment, she has something to fall back on. Now, there are key advancements in reproductive and fertility medicine. So, who needs this procedure called egg freezing or ovarian tissue freezing? People do it for medical reasons, genetic reasons, and socially as well. So let's look at some of the medical reasons why we would ask a lady to go and freeze her eggs. Like I said, if the lady is going to be having cancer treatment, is advised, go and preserve your fertility before coming for such a treatment. Some women diagnosed with endometriosis at an early age or at an early stage, they still have a chance, because the effect of endometriosis, it has a negative toll on the ovarian reserve. So when a lady is diagnosed with endometriosis and is not very moderate to severe, maybe it's mild, ovarian cryopreservation would be an advice, that she should go and freeze her eggs. Autoimmune diseases, thyroiditis, and autoimmune diseases are diseases that can make a woman's body to begin to destroy its own ovarian reserve, like the eggs. So when there's a diagnosis of an autoimmune disease, you want to advise the lady to quickly go and freeze her egg so that she can preserve her fertility. Ethics also is one of the common reasons. Women have just one X chromosome, an O and an X chromosome. Now, because she has just one X chromosome and it is diagnosed early, she has a chance of going to freeze her eggs, because this will drive her into an early menopause or premature ovarian insufficiency. So these who have this BRCA mutation, that's a biomarker for ovarian or breast cancer. Once it is detected, you really want to quickly go and freeze your eggs, because you probably need chemotherapy in the future. Some women who have premature ovarian insufficiency, the ovarian hormones, estrogen, for example, when you do a blood workup, maybe you come for a routine fertility check, and they found out that the estrogen level is low, and follicle stimulating hormone and all the other hormones are going high, and the AMH is also low, and you scan and they find out that the amount of follicles in both ovaries are not sufficient. Such a candidate should quickly go and freeze her eggs. Social reasons. Delaying childbearing due to career. Like I said at the beginning, life has evolved. Women want to pursue their career. They want to take their time to have their own children. They want to, back then in those days, education, once a lady just has her primary school, she's giving out in marriage. But now, they want to have their PhD before thinking of, having children. While that dream is very good, and it's good that they pursue it, it's very important that these discussions are taking place, that the biological clock is not waiting for you to finish your PhD, because that's just how it is. So you want to consider freezing your eggs if you want to increase your career or you want to pursue a degree. And also, absence of a partner. This is another very important reason. If Mr. Right is taking his time to propose, you see some ladies are in a relationship 1 year, 2 years, 3 years, 4 years. You are asking Mr. Right, what is wrong with you? He's taking his time to propose. Young lady, please go and quickly freeze your eggs, because your biological clock does not understand that Mr. Right wants to be the youngest millionaire first. He wants to have a BMW first. He wants to have a big house before he settles down with you. Okay, so this is very important. So now, options for fertility preservation. There are about 3 of them. You either want to freeze your eggs, which is the gold standard, or you want to freeze your ovarian tissue. Either part of the cortex, that's the outer part of the ovary, that is where the eggs are found. Some women can have part of that tissue preserved, okay? And when they want to now have their children, it can be reimplanted, okay? And also another option is embryo cryopreservation. This, at this point, we are not talking about eggs now. We are talking about an embryo. An embryo is a fertilized egg. That means at this time, sperm has been introduced into it and it has divided and formed the minutest form of a human being called an embryo. So there are some legal and ethical considerations at this point. For example, the lady is not married. She wants to preserve embryos. Now she probably gets an unmarried partner who also needs to sign consent. Okay? Now, who is the real owner of the embryo at the end of the day? Because man and woman has contributed to a baby. Now they are not married. Or maybe married couples later separate. Who is the real owner of? So those are some of the ethical considerations that may occur when you are freezing embryos. And also, what if, for instance, the lady who has frozen her embryos passes on? Who is going to inherit the embryos? So many issues come up, and we'll look into some of them. So what are the steps on oocyte cryopreservation? Oocyte, like I said, is the egg. What are the steps? Step number 1. I told you earlier that a woman will ovulate 1 egg per month. And that begins to reduce her ovarian reserve about 300 to 500 times in her entire obstetric or her reproductive lifetime. So, but with IVF, you give her ovarian gonadotropins, which are medications that will make her produce more than 1 egg, at least multiple eggs. So the eggs are then, in the course of her receiving this treatment, she'll be coming for scans. So monitoring is the next step. We're doing it under ultrasound scan guidance. And also her hormonal levels are measured. The estrogen begins to increase to give us an idea that she's developing follicles and oocytes as well. So while the monitoring is ongoing by the medical team, at some point she'll be given a trigger shot to mature the eggs. This stimulation will take place about 10 to 12 days in her cycle, usually at the beginning when the ovaries are rested. So as the stimulation is ongoing, you begin to see her begin to produce many eggs that will begin to grow in size as they progress. Around on the 14th day of her cycle, she will be taken to the theater, and under ultrasound scan guidance, on sedation, the eggs are collected. This is not a surgical procedure. She will not be opened up, but transvaginally, an aspiration needle is inserted to her ovaries as is shown on the screen under ultrasound scan guidance, and the eggs are retrieved. And they are put into a tube where they are now passed to the embryologist, who will now further look at the eggs and begin to get them ready for freezing. Now, the embryologist will probably look out for the matured eggs, because you want to freeze the eggs and you want them to also recover well. So the best eggs that are meant for freezing are the metaphase 2 oocytes, which are the matured egg. So the steps of vitrification, they will have to get the eggs and mix them into some certain media that are protective rather. The cryoprotectant will enter into the egg and protect things like the nucleus, the vacuoles, and all the components of the eggs, so that by the time the eggs are now put into the liquid nitrogen that will now freeze them, the internal structures of the eggs are not destroyed. Okay, so ultra rapid freezing of matured oocyte takes place, and this temperature is so low as 196 degrees to minus 200 degrees, minus 196 degrees to minus 200 degrees. So what about tissue freezing? It's done surgically under laparoscopy. So the lady is put to sleep, laparoscopy ports are inserted, and either part or the whole of the ovary is removed and preserved. Remember, it's used for people, maybe ladies, young ladies who have been diagnosed with cancer and will have to undergo treatment. And after the treatment, they will now also come back for reimplantation of the ovary, when pregnancy is desired, useful for pubertal girls when urgent treatment is needed. So now everything has its own success. What's the success rate of, what's the success rate and factors that have influenced the outcome of this egg freezing or tissue freezing, ovarian tissue freezing? What are those factors? 1, the best result is achieved when it is performed on women under the age of 35. So when a woman is freezing her eggs in her early 30s, the rate at which they will recover in the future is better. About 40 to 60% of pregnancy rate can be achieved when it is done earlier, because the quality of the egg is maintained. Okay? Imagine a lady who decides to freeze her eggs at the age of 30, and Mr. Right comes when she is 40, and she's trying to get pregnant and it's not seeming to be so. She has a 30-year-old egg. Even while she's 40, that egg is still 30 years old. The quality is still very good and viable. She has a high chance of getting pregnant than a lady who decides that she wants to start freezing at the age of 40. Remember, there are eggs, but the quality now has reduced. So what about ovarian tissue reimplantation? What's the success rate? It results in spontaneous conception in about 30 to 40% of cases. Okay, so it's good. All right, so it's a method to explore. Other factors influencing outcomes include specific techniques used, freezing protocols, storage condition, the liquid, the liquid nitrogen vaporizes, whether you open it or not. So you want to be sure that at every time, the level of the liquid nitrogen in the tank is always maintained by the facility. So that can be a very serious consideration. And patient's underlying diagnosis. Imagine a lady who doesn't have any medical condition, just walks in and decides to freeze her eggs at the age of 30. Her success will be different from another lady who has some other underlying medical condition. Okay? Like endometriosis, fibroids, and so on and so forth, PCOS, and so on and so forth, polycystic ovarian syndrome. Every procedure, everything in life has risks, and of course, consideration. So let's look at ovarian cryopreservation. What are the risks involved? Because a lady will have to go through the process called in vitro fertilization, IVF, she can be given, her body, for instance, can respond to the hormones that she's taking. Of course, the monitoring phase, like I said, is there, where her response to the treatment is monitored. However, there are still some category of women who are maybe polycystic in nature, or are given high dose of human chorionic gonadotropin, which matures the eggs, and they now begin to produce too much fluid in their abdomen. That is called ovarian hyperstimulation syndrome. It is one of the risks involved in the process of you going to freeze your eggs, all right? But of course, it's manageable and preventable, okay? Then of course, cost and accessibility remains a major barrier. Like we have said, the lady in the village and the lady in the city, they both have biological clock. But one may not be able to afford this service, but needs it, but because of the cost. The lady in the rural area probably doesn't have a well-paying job and may not be able to afford the cost of going through this treatment. So it becomes an issue, a consideration. And some places you may not have an assisted reproductive technology center where this service can be made available for these ladies. Yet, it is important to freeze your eggs because the biological clock is ticking. And there are emotional and ethical aspects of storing reproductive tissues. Now that I have frozen my egg, it has brought hope, right? It brings hope to them. And at the same time, they are anxious. When I now marry, will those eggs still be viable? You know? While it brings emotions, you also want to think that ethical issues like, what if the lady passes on? Who inherits the eggs? What if she decides to get a donor sperm and become a single mother to have offspring that are biologically related to her? How will society perceive her? Will they be judgmental? Or will she be bold enough to say, I'm taking this decision to move on because Mr. Right has not come. I've frozen my eggs and I cannot keep waiting, but I'm going to get a donor sperm and I'll fertilize those eggs and have my own biological children. So another consideration is surgical risk for tissue extraction. Of course, it's a procedure. Many structures are around the ovary. You have the bladder, you have blood vessels. So there's risk of bleeding, which can be managed and avoidable, and also infection. Of course, this will not be a big issue because before you are undergoing such a procedure, thorough cleaning is being done before the procedure starts. While we have been talking about the ladies, do men also have biological clock? Yes, they do. It's just that the one for the lady begins to ring an alarm at the age of 35. While men, because of their nature, they produce sperm cells. So as the sperm cells are dying, they are producing sperm cells as they age till they get to andropause. Now, you find out that men, after 120 days, they produce new sperm cells. Unlike ladies that have fixed deposits, finite number of eggs that they spend from. So in a way, ladies spend from, while men, while they spend, they replenish. They produce, they replenish. And so, male infertility is real. And men too should begin to consider freezing their own egg. You know one thing about our society in Africa? Men are not seen as the one that have the problem. Because it's the lady that will be pregnant. Imagine you get married, 6 months down the line, everybody's looking at your tummy. You know, they are not looking at the guy. The eyes are always on the woman. So, male infertility contributes to 50% of challenges in couples. I found out that 1 in 6 newly married couples have infertility. That is how it has increased over time. And what are the causes of male infertility? Low sperm count, poor motility. Now, when we say low sperm count, we're talking about the number of sperm cells per ejaculation. Low, poor motility. How are these sperm cells moving? Are they moving in a straight? Probably just be moving around the egg. But when there is good motility, progressively, the chances of pregnancy is high. But we are beginning to see motility issues, morphology issues, the shape of the sperm. How many of you have seen a tadpole, a baby frog? Not exactly so, but that's how the sperms looks like. They have the head, they have the neck piece, and they have the tail that swims. So morphologically, are men having thin pinhead sperm cells? Some men, they have double head sperm cells. How is that going to fertilize? So these are some of the issues that are creeping in and causing infertility. And infections too, sexually transmitted diseases, they both affect both male and female. while it can block the fallopian tube of a woman and cause infertility, it can also affect the testes and cause all manner of damage to the sperm cells and also the tubes. Toxins are there, exposure to chemicals at the workplace, occupational hazards, and exposure to so many things presently in our world. When you go and buy fruits, they have been preserved or ripened by chemicals. In Nigeria, we know what they call carbide. So the more you take some of all those fruits that are exposed to toxins, it can cause infertility. Point and kill fish have been grown with fertilizers. You are eating noodles non-stop as your only quick fix. But you know there's preservative in there, carbonated drinks, and so on. The list is endless. We now live in a fast world that you just have to look for something to, put in your tummy and get by. But we are exposed to so many toxins nowadays that is making the infertility rate to be as high as 17.5% globally presently between male and female. And also age plays a very important role. When men hit the age of 40 to 55, their sperm quality declines. So you want to also go and walk into an IVF center or an assisted reproductive ART center and get yourself checked. Once you hit that age and you are still single, you want to know so that options like sperm freezing can be worthwhile while you are taking your time to, get yourself ready. And also stress. Nothing destroys sperms like stress. Men, they don't rest nowadays. They are hustling, looking for money. They are not sleeping well. They are not resting well. First thing in the morning, you're out looking for money. Mental stress is also there. The bills are looking at you. It destroys the sperms. So it's a challenge. So what are the options for men? Sperm cryopreservation is a very simple procedure. You just walk in, tell them, I want to do an analysis, I want to freeze my sperms. A patient of mine came to see me a while ago, like 2 years ago. And the sperms that we saw, they were just about 8. I told him, young man, go and freeze your sperms. By the time he was coming for another cycle of IVF, there were no sperm cells again. The only thing to fall back on were those frozen sperm cells. So, it's effective, it's a reliable way to preserve male fertility. It's often done also before cancer treatment or vasectomy. Vasectomy is a way of male sterilization when a man wants to, have his own contraception. The vas difference is just either tied, cut. Next is testicular tissue freezing. It's also an option, but this is experimental for young boys who are going to be having treatments like cancer chemotherapy treatment. So what does the future hold in this whole discussion? Right now, there are artificial ovaries and 3D printed scaffold for follicular support. They are using collagen substances to build an ovary. They have tried it on mice. They built an ovary, put immature eggs in there, and this structure was able to keep the eggs in check. So while age is supposed to be happening to ovary and reduce the ovarian reserve and the egg quality, the future says that there will be artificial ovaries that will keep the quality intact. So this is quite experimental, but very soon, everything is AI now. It's working. Before you know, women will be going around with artificial ovaries installed in their peritoneum. Improve cryoprotectants and automation in vitrification. Now, like I said, before any garment is frozen, you have to put it into a cryoprotectant. It is a media that will go into the that gamete, either the sperm or the egg, and protect it from the low temperature of minus 196 degrees centigrade, that egg or that sperm will be stored for the time being till it is needed. Before, when eggs are frozen many years ago, chance of recovery were slim. But presently, with this improved technology, it's increasing. That means in the future, you will have close to 99% chance of your matured eggs recovering because of improvement in technology. Personalized fertility preservation plans based on biomarkers. A young lady walks into the IVF clinic and she wants to do hormonal profile, her AMH level, she checks it, and you know the AMH level, you can do it in any time of your cycle. It's not cycle dependent, it's not like day 3 or day 2, day 21 test. The AMH, anytime you can do it. The AMH anti-malarial hormone test tells a lady how much eggs she has reserved in her system. So a lady comes in for a routine check. She's 30 years old, and her anti-malarial hormone is 1.0. For her age, that is low. So such a lady should quickly be counseled to go through this process of stimulation and freeze her eggs. Because in another 1 year time, it may not stay at 1.0. It will probably be lesser. So personalized fertility preservation plans based on biomarkers, based on ultrasound scan findings, not just AMH, follicle stimulating hormones levels that are very high, luteinizing hormones that are very high, with low estrogen, should be a pointer to that lady that, hey, quickly go and freeze your eggs. So, in summary, what have we taken from this presentation? Ovarian cryopreservation is an essential reproductive option. It means that you can run ahead of the biological clock and pause it, while you take your time to do other things that are priority, such that when it is time for you to have children that are biologically related to you, you can come and thaw those eggs. Imagine a lady who has her 30-year-old picture. It's like a frozen version of herself. That picture is her frozen state. When she's 40 years old, what we are trying to say is that she can do abracadabra. She can blow life into that 30-year-old picture, and it comes back at the age of 40. So her fertility can be preserved using ovarian cryopreservation. Like we said, it is done, if it's done earlier, the better, because of age and quality. Okay? Because age has a toll on quality. Careful patient selection. Who needs this service? What time should you do it? And counseling are key. That's why we're having this discussion. So not only should we have this discussion in this kind of environment where we are talking about assisted reproduction, even in churches, even in the family front. I mean, imagine a father calls the daughter and say, you are going to be 30 this year. I want to give you a gift that will protect, like insurance of your fertility in the future. Let me sponsor an IVF treatment for you. You go and freeze your eggs. You may not need it. She may meet Mr. Right when she's 32 and she has all her children. So those eggs are there. If she decides to have more children, maybe when she's 40, she's not desirous of maybe one more child, and it's difficult, she has something to fall back on. Okay? So a multidisciplinary approach improves outcome. Now, of course, you have to start the discussion. You have to come to the fertility specialist who will do all the tests, analyze, check your fertility potential, and advise. Or if a lady is undergoing chemotherapy, an oncologist who is a doctor of cancer can also advise, say, go and freeze your eggs. And of course, when she comes for the IVF, she will interact with, for instance, if you're coming to us, you interact with me, you interact with my nurses, and so on and so forth. Thank you so much for listening. And I hope that this will stir up conversations amongst ladies, amongst people who have young people that are close to them. This conversation should be held, because I remember I had a patient who walked into my office and said, after we have done her tests, we were doing the results review, and she told me, so the options were now, one, either you use your eggs and do pre-implantation genetic diagnosis on the embryo, the resultant embryos, being that you don't want to have an abnormal child. So she will go through IVF, she will do the PGD for short, and these are expensive options. Or the second option is to just go and use a donor egg. She busted into tears. She didn't have the money, and she really wanted biologically related children. She told me, she said, Dr. Charles, I was always pregnant when I was young. I was always pregnant. If a man touches me, I'm pregnant. I wish somebody told me to freeze my eggs when I was at that peak of my fertility. So that is why this conversation should not just stop here. We'd like you to share this video. We'd like to, spread the word. Let the communication start. And I believe that with this knowledge, women are able to put a pause on the biological clock. Thank you very much.
Ladies and gentlemen, please, you can do better than that. Kindly jam those hands together for Dr. Charles. So we're going to do a live demo right now. We're going to do a live demo. Because one beautiful thing about my career as an MC is I get to learn at every event I anchor. I have live occurrences around me, friends who are at the age of 38, 39, who are about to get married, but they've never been aware that you can actually freeze your eggs. And also relatives, friends who are also above the age of 40 and have not gotten married, but also do not know that you can freeze your eggs. So we're going to do a little demonstration, and your response is going to be, freeze your eggs. Can we do that? Can we repeat after me? Freeze your eggs. Freeze your eggs. That's too low. Freeze your eggs. Freeze your eggs. So I'm going to make a statement, and you respond with, freeze your eggs. If you are above 30 and Mr. Right is not yet coming, what do you do? Freeze your eggs. If you are above 40 but you still want to pursue your career, what do you do? Freeze your eggs. For some reasons, you are in your 30s, but then you're not ready for marriage, what do you do? Freeze your eggs. So if you've taken nothing away from this conversation, this live broadcast, you should know that the most important channel that we've talked about today is freeze your eggs. And also, like we have heard, infertility is not just for the woman. Infertility affects the man as well. You are a man, you work in a hazardous environment. What do? Freeze your sperm. Man, no get egg now. Man, no get egg. So let's take it again. You're a man, you work in an hazardous environment. What do? Freeze your sperm. So it's a beautiful conversation. I'm glad that I'm anchoring this program. It's a way of creating awareness for fertility, promoting fertility, and also reducing infertility. Ladies and gentlemen, please, once again, put your hands together for Dr. Charles Ojeabuo. All right, our next resource person is Dr. Gina Terinoni. Dr. Gina Terinoni is the Director of Traditional Chinese Medicine, Holistic Fertility Specialist. She's a holistic fertility specialist, like I said, with over 23 years of experience supporting women in their reproductive journeys, with a doctorate in traditional Chinese medicine and certification from the Women's Integrative Medicine Institute. She blends ancient Eastern healing with modern fertility science. Her personalized approach to care, rooted in mediation, yoga, and integrative support, has helped more than 2,000 women conceive and thrive naturally or through assisted reproduction like IVF and FET. Ladies and gentlemen, please put your hands together for Dr. Gina Terinoni. Put your hands together for Dr. Gina Terinoni. So we are going to go live by sharing the lecture from Dr. Gina Terinoni. Please, over to her.
Hello, everybody. My name is Dr. Gina Rosella Terinoni, and today I want to talk to you about how to enhance egg quality and fertility in your late 30s and 40s. I'm so glad you're here, and thank you so much for inviting me to speak with you today about my most passionate work, fertility, and helping women and men to create their families. So let me take you back for a moment, because this journey started nearly 25 years ago in my clinic when I was living in California. I now live in Colorado in the US. So a woman came to see me after her 8th failed IVF cycle. She was heartbroken, exhausted, and out of options, or so she thought. So why do I bring this up? Because I was newly out of school and was very intimidated by her health experience. And honestly, I even tried to tell her I wasn't experienced enough to work with her. But she was adamant that she work with me. And she said, I know you're going to help me. So we worked very closely together on her nutrition, her stress levels. We worked with herbal medicines, acupuncture, and I would say I asked her to take a break from IVF because she had 8 failed and she was very deficient and she needed support. So I asked her to take a 6-month break. And from what I can remember, it took her, her next IVF was about 9 or 10 months and she got pregnant. And so she went on to have a healthy baby boy. And I went on to realize after this experience with her was that this is what I want to do. I've always worked in school. I wanted to specialize in women's health. And I was really into harmonizing hormones and helping women to have regular menstrual cycles and to get rid of pain. So I do work with a lot of women who have endometriosis, PCOS, and unexplained infertility. These are the areas that I specialize in and that I've been working with for over 25 years now. There's nothing more rewarding than this work that I do. This was the beginning for me of what's now been decades of helping women and couples conceive, with or without IVF. And I have worked with a number of IVF clinics locally, and I would administer acupuncture to some of my patients in those clinics, but also help to support them leading up to their transfer or leading up to the egg retrieval. So it just kind of depends on the person. There's room for both. I'm definitely not anti-Western medicine. In fact, I'm certified in integrative medicine. So I completely understand and work with Western medicine plans as I work to help women to improve their health with natural and holistic medicine. So I do work with women who are using IVF, and I help make it more effective through personalized holistic care, because your body still needs support no matter which path you choose. And my approach is rooted in traditional Chinese medicine and integrative medicine, but I'm grounded in real clinical experience. I help women all over the world, and I'm so excited to share this information with you today. So here's a little bit of what we'll cover today. This is a very big topic, but these are what I feel like are most fitting. And we're going to work on a holistic approach to reproductive health and wellness in your 30s and 40s. Does fertility really drop at 35? Fertility nutrition using local foods, the right supplements that you could add in to support egg quality specifically. So this is perfect before an egg retrieval. Gentle movement to nourish reproductive health, mind, body, and hormone harmony, detox and environmental awareness, and of course, traditional and holistic fertility support, which is what I specialize in. Now, you've probably heard this number thrown around like a warning, but let's break down what's actually happening in your body after you turn 35 and what you can still do about it. Not all 35-year-olds are the same. Not all 40-year-olds are all the same. So I'm going to give you some information here and just to have a reality check of what the general population who's not adding anything else in. This is women who are just trying to conceive naturally, and this is pulled data together. So I'll give you some numbers here. Age 35, there's about 45 to 50% of good eggs, good quality eggs that are left. And this is the start of a steeper decline, and miscarriage risk begins to increase. By age 36, 40 to 45% good quality eggs, and egg quality and chromosomal abnormalities begin increasing. And then we see this, just a steady climb, 37, 38. By the time a woman's 39, the average estimated percentage of good quality eggs is only 25 to 30%. And as we're seeing that, then miscarriage risk is now up to 25 to 30%. And egg quality is a major factor in this cause. And then we get to 40, 41, by 42, estimated percentage of good quality eggs is about 10 to 15%. And at 42, natural pregnancy rate per cycle is less than 5%. Miscarriage is about 40 to 50%. And then I'll skip through and say by the time a woman is 45 or older, less than 1 to 2% of eggs are good quality. And then, of course, donor eggs are often recommended. Now, like I said, this can depend on where a woman's located, what she is doing for natural health on her own, if she's taking herbs, how she's eating, what's her stress level. There's so many factors. So let's get started. Let's see what we can do. So egg quality changes, but so can you. So mitochondria, this really matters. This is where your power lives. Your mitochondria, your stress levels, and inflammation, they all impact and affect egg health. And these are the exact things that we can support holistically. So your eggs are influenced by how you live, how you eat, move, and think. Egg quality can decline, but it can also improve. I've seen this happen over and over again with my fertility patients and clients. This is where the science meets your power. Eggs don't just appear on the day that you ovulate. They're influenced by your hormones, inflammation, nutrition, and lifestyle over the 90. So, when you start making small shifts today, how you're eating, how you rest, how you breathe, you're not just changing this moment. You're shaping the eggs that you'll ovulate 3 months from now. That's the beautiful part, is that the results may take time, but the healing starts immediately. And egg quality, it is not just about age. Biological age is more important than chronological age. Your body may be 39, but your eggs could be thriving if you've nourished them well, or struggling if you have been depleted. Why? Because egg health is influenced by inflammation, oxidative stress, and hormone balance. And the best news, these are the exact things that we can address through holistic daily care. An emphasis on daily care. One of the most overlooked fertility tools is the food that's already in your kitchen or growing locally near you. There's no need for expensive imported superfoods when you have access to some of the most nutrient-dense options on earth. Foods like moringa, bitter leaf, tilapia, pumpkin seeds, millet, these are loaded with the exact nutrients that support egg quality: iron, folate, antioxidants, omega-3s, and minerals that all protect your cells. And beyond nutrients, we want foods that also reduce inflammation, support blood flow and circulation, and nourish the digestive fire, because healthy digestion means better absorption of nutrients, and better absorption means more support for your ovaries and for your womb. So what matters most is that your food is clean, local, fresh, and consistent. You don't need to be perfect. You just need to be nourishing yourself intentionally every single day. And I'll plug in a note here is that women that I work with, we work on a journal together, and I have them write down the time of day that they eat: breakfast, lunch, dinner, and if there's any snacks. So ideally you would have, for example, and again, this depends on work and what your life situation is, but ideally you would have breakfast within the same hour every day. So 7 days a week you're going to eat, for example, from 7 to 8 a.m. Lunchtime every day of the week is between 11 to 12 or 12 to 1. And then dinner would be between 5 to 6 or 6 to 7. Pick your times. I talk extensively about food, how to prepare it, how to not eat raw foods all the time, and cooking and stews. Broths are much easier for digestion. It really just depends on the woman and what kind of diagnosis she has. If she has a diagnosis causing infertility, or if she's got digestive issues or bloating and gas, there's so many things to factor. But I wanted to give you the idea of consistency and everyday, and of course being sure to get plenty of protein and vegetables and healthy fats. So in traditional Chinese medicine, and this is my original background is herbal medicine and Chinese medicine, we look at food not just for its nutrients, but also we look at the energetic and the organ supporting qualities. So when it comes to fertility, we're focused on nourishing the kidney, liver, and spleen systems because they are deeply involved in egg quality, hormone balance, and reproductive vitality. So protein-rich foods help build blood, and in Chinese medicine we also call Jing, so sexual essence, the vital essence that's in charge of governing the egg reserve and reproductive longevity. So think about eating eggs, lentils, fish like tilapia or sardines, and pumpkin seeds. These strengthen the kidneys, nourish the blood, and support ovulation. And then healthy fats, especially omega-3s, are essential from both a biomedical and a TCM or traditional Chinese medicine look. They moisten dryness, they move the liver, which is in charge of oxygen and blood flow, and they calm internally, all of which help regulate hormones and menstrual cycles. So foods like avocados, olive oil, fatty fish, or red palm oil in moderation, they support both hormone production and cellular repair. We also consider warming, grounding foods, like I had mentioned, like bone broth, small fish with bones, black sesame seeds. All of these are good for kidneys and replenishing sexual energy. These are especially important for women over 35. So women who we see with like what we say is weak pulses. And food, not to go too deep into that because I've got a lot more to talk about, but in short, food is medicine, but only when it's eaten intentionally, consistently, and in rhythm with your body's needs. So rather than chasing expensive imported items, I encourage you to look around and embrace what's growing around you, what your neighbors are growing. If you've got farmers markets like we've got here, focus on those foods and eat cleanly, clean proteins, healthy fats, deep nourishing whole foods. Every meal that you eat is a chance to nourish your future fertility health. You do not have to be perfect. You just have to be consistent. So while food should always be the foundation, supplements can be a powerful therapeutic tool if they're chosen carefully to support egg quality at the cellular level. So in both Western research and traditional Chinese medicine, we focus on protecting the egg from oxidative damage, improving mitochondrial energy, and supporting hormonal signaling. So let's walk through some of the most commonly used fertility supportive supplements. First, we'll look at CoQ10 or ubiquinol. This fuels mitochondria, and that's the energy center of your eggs. And next, we've got myo-inositol. This helps balance insulin and supports ovulation. Omega-3s reduce inflammation, and they help regulate hormones. And vitamin D plays a vital role in hormone balance and immune health. Depending on where you live, like in our area, even if we get a lot of sunshine, a lot of women who are trying to conceive, and I know I was really deficient in vitamin D. So most clinics will check for that, or doctors will check for that if you're having trouble conceiving. And then we want to look at methylated folate. This supports egg DNA and early development of the baby. So in traditional Chinese medicine, I also consider signs of what we consider called dampness, stagnation, blood deficiency, kidney depletion, so that the supplements match not just the diagnosis, but your pattern diagnosis. And then we'd look at herbs like goji berries, dongui, red dates. These can be powerful, but there's thousands of herbs, and I reserve really talking about those for personalized care since they're not always available and not always appropriate for everyone. So while these supplements can help, I want to emphasize you do not need all of them. And the key is precision, not taking more and more and more. It's common when I work with women that they'll send me a list of 25 or 30 things that they read about online, and they're conflicting, and it's just too hard on your system. You don't need that many supplements. So personalized support, this is always, personalized and intentional support is always going to outperform overwhelm. And in both traditional Chinese medicine and modern science, we know that circulation is everything when it comes to egg quality and hormonal balance. If there's a stagnation, whether it's physical, emotional, or energetic, your ovaries don't get the blood flow that they need and the nutrients that are required to grow a baby. Your hormones don't move properly, and your stress system takes over. That's why I always recommend gentle, restorative movement to support reproductive health. Not intense cardio or exhausting HIIT workouts. Those can actually increase cortisol and steal resources from your ovaries. Instead, think waking up, going for a beautiful walk as soon as the sun's coming up. That can also help reset with melatonin in the body, so it'll help regulate your sleep. But I also look at yoga and stretching to open the hips, soften the abdomen, regulate the nervous system, joyful movement like dancing, swimming, slow bike riding or cycling, because pleasure is medicine too. And in Chinese medicine, we say that when the liver flows freely, the entire reproductive system thrives. Movement is how you get that flow, especially if you sit a lot, feel emotionally stuck, or if you have experiences like PMS or endometriosis or PCOS. This is crucial here. So the goal isn't going to work out really hard. It's to move with intention and bring energy back into your womb space where it's safe. When you move gently, you send your body the message. You're safe, you're fertile, and you're supporting yourself. So this is another overlooked part of fertility health, and it's one of the most powerful. Your hormones don't respond to apps, to checklists, to stress, to pressure. They respond to your nervous system, your breath, and your belief in safety. So in Chinese medicine, we say that the heart and the uterus are connected. If the mind feels anxious, the womb will tighten up. If your stress is unprocessed or worked through, it can block your cycle flow and weaken ovulation and weaken having a regular cycle. So that's why daily nervous system care is a non-negotiable. Simple things like deep breathing before meals, journaling to process fear, frustration, or just talk about your day, and try to add in gratitude in your journal. Journaling, I already mentioned that for fear, but also just spending time and maybe noting like what time you're eating your meals, what time you exercised, that also, and like maybe you see energy dips throughout the day. I ask a lot of these questions when I work with women just because it points us to specific areas that we need to focus on, like a red flag area. So acupressure or patches, like I have a herbal patch on my back right now, but we put patches on different parts of the body for calmness, clarity, but also specific points for fertility. So this doesn't have to take a lot of time. Even 5 minutes a day of consciously slowing down tells your brain that it's safe to shift into healing and that it's safe to conceive. So remember, your hormones are messengers, but they can't deliver if the lines are clogged with stress. The more you feel peace, the more your body believes pregnancy is possible. Your eggs are incredibly sensitive to what you're exposed to daily, especially synthetic chemicals, plastics, hormone-disrupting toxins. The goal here isn't to panic or cleanse. It's to create a cleaner, more supportive environment over time. So let me walk you through these a little bit. So you want to start by swapping plastic containers and water bottles for glass or stainless steel. Heat and acidity pull chemicals like BPA into your food. So definitely look for BPA-free products, because if you get these chemicals in your food or in your body, they can mimic estrogen and disrupt ovulation. And then you want to look at your skin care, your hair care, makeup, and cleaning products for around the house, like especially kitchen and bathroom. Anything that you put on your skin or spray in your home, this gets absorbed into your system. So make sure that you're choosing simple, natural ingredients whenever possible. If you have a hard time finding chemical-free cleaners, look into getting and cleaning with vinegar. I like to use vinegar when I clean in my house, especially the bathroom and the kitchen. And you want to drink filtered water daily. Add lemon or chlorophyll in the morning. These gently support your liver and reduce internal heat, which in traditional Chinese medicine terms can contribute to hormonal imbalance. And you want to make sure that you're including in your food liver-supporting foods like beets, vegetables, leafy greens. These help your body to metabolize excess estrogen and clear environmental toxins. And you could try weekly Epsom salt baths or work up a sweat through gentle movement. Sweating is a natural detox pathway. It also relaxes your nervous system. And finally, avoid unnecessary toxins in pesticides, artificial fragrances, or perfumes, air fresheners. These can silently accumulate and disrupt your hormone signals. You don't need to be perfect. I can't stop saying that. Every little change that you do, these add up. And when you reduce your toxic load consistently, your body becomes a more fertile, receptive environment month by month. And I want to just have a special message in here. You do not want to do any kind of hard detoxing while you're actively trying to conceive, because if and when you do get pregnant, those toxins that you're trying to flush out of your body can get passed on to the baby. So when I work with women and they need to do, because they've got something picked up and detected, and they need to detox, sometimes we'll do that at least 6 to 9 months before trying to conceive. So please be cautious. Everything I just mentioned are good ways to help your body detox. And this final piece is deeply personal to my work. As a doctor of Chinese medicine, I've seen again and again how deeply transformative personalized herbal support and energetic practices can be, such as meditation or Tai Chi or Qigong or breathing practices, especially for women who've been told that there's nothing else they can do. So we already talked about herbs that we could do, but I don't want to mention those, but there's specific herbs that nourish the blood, they can rebuild essence and support follicular development, but only when matched properly to each woman's individual constitution. That's why I'm not going to give you a list of 100 herbs that help with fertility, because that's just too much. And you need somebody who can work through them and decipher what is the best route for you. This is not a one-size-fits-all protocol. So it's a conversation with your body's signals. I don't know if you follow me on Instagram or TikTok or YouTube, I do tongue analysis. We talk about pulse, we talk about cervical mucus, and we also talk about emotional state. So even if herbs aren't accessible where you live, there are still powerful things that you can do. So physically would be like castor oil packs, or moxibustion may be available. Acupressure and womb connection rituals can open energetic flow and promote healing at a deep level. And of course, we always would focus on nutrition and dietary habits, sleep, and just lifestyle ritual and habits that are supportive of your fertility journey. And all of these tools that I mentioned, I use all of these inside my one-to-one fertility coaching, one-to-one one's full spectrum support, body, mind, spirit. I also have mini courses that you can follow along and do yourself. For example, I've got mini courses that have meditation, yoga, acupressure chart with a 15-minute guide to walk you through massaging specific points on your body that help depending on what you're dealing with. And I also love the Fertility Fast Track. That's my 7-day support guide. And I walk you through the guide with audio support and charts. So that's a very helpful place to get started. I know that this journey can feel heavy, it can feel overwhelming, and sometimes it's hopeless, especially when your friends or your family members are pregnant or they don't understand what you're going through. But I want you to know that you are not broken. Your body is communicating, and it just needs someone who can understand its language. And I see myself as a detective, where when I work with women, I help them connect the dots. And holistic and integrative medicine is perfect. It's comprehensive care. Whether or not, if you're using IVF, it'll increase the chances. You want to get in touch and have a strong relationship with your body so you can understand the symptoms and be able to communicate with your body properly. So that's why I do this work. I've helped women in their 30s and their 40s, women with low AMH or poor ovarian reserve, poor egg quality, had multiple failed IVF, miscarriages, or just trying for years. I think I've worked with women, I'm trying to think, 9, 10, 11 years of trying to conceive, and they've been able to conceive after we worked together and identified the red flags. You just need to figure it out. You've got to talk to your body and figure out what it's telling you. And you can improve your chances to conceive by restoring balance and healing the root causes. There's a web. It's not one thing. Usually it's the relationship of different organs in your body that need to be strengthened or calmed down a little bit. So research shows that using integrative and holistic medicine in combination with IVF dramatically increases conception rates while using IVF by up to 60-65%. And if anything shared today resonated with you, I would love to hear from you or support you, whether it's through a personalized plan, our coaching, or our private community. I have a private podcast and community. I'll meet you wherever you're at. You don't have to figure this out alone. You deserve to be supported on your fertility journey. You deserve answers and tools and clarity. I don't want you scrolling online for several hours a day trying to look for that magic post. The information is here. So thank you, my gosh, thank you so much for allowing me into your story. I'm here if you're ready to be supported on your fertility journey. And I just wanted to share this photo of my family. This was taken where we live now in Colorado. This is Mother's Day this year, 2025. I wish you the absolute best wishes on your fertility journey. I had my son just 2 months shy of 42, and my husband was 45. And I love this photo because it wasn't always easy, and we got here. And I wish this for you. And thank you again. And I hope to talk to you soon.
Ladies and gentlemen, please can we put our hands together for Dr. Gina? Yes. So the beautiful thing about this, having this conversation online and physically, is what people pay through their nose to gain knowledge of is what we are witnessing, and Dr. Charles and Barrister Victoria are bringing to us free of charge. Please put your hands together once more. So if you have learned nothing from Dr. Gina, I want you to hear a story. So a friend of mine got married at the age of 35, 32, and I think my beautiful wife, my PA is also here. We got married at the same time, and we conceived almost immediately after marriage, probably because my wife was a bit younger, having this knowledge, and that's why I'm not saying now, probably, because I had no idea. So they married in their mid-30s, but were unable to conceive for 2 years. It was a big worry for them. I had to take them to a fertility center that I'm aware of, and I know you've all heard this story. There is nothing wrong with you. You've had this experience, right? Where the doctor will say, there is nothing wrong with you, the man. There is nothing wrong with you, the woman. I'm sure, listening to Dr. Gina now, you will realize that egg quality also matters, both as a man, sperm quality as a man, then egg quality as a woman. And then the things we need to do to enhance the egg quality, like she said, eat natural food, also eat oily fish, fruits and vegetables, then eat lots of nuts. So tiger nuts that you've been avoiding, you could take tiger nuts now. You could you proteinize tiger nut a lot now. And that is a way we can also enhance our egg quality. But before we go to our next resource person, who's going to give us lecture on managing emotional well-being during the in vitro fertilization process, please, I would like to, our online viewers, our online audience, please, I would like us to take just 10 seconds to share this live broadcast, share the link to your friends, family, to the groups you belong to socially, please. Those here and those online as well, you could as well share the links. Let people benefit from this symposium. So we are not just the ones that are benefiting. We have friends, we have families who are also battling infertility, who are not battling yet, but they need to be aware that infertility can be a thing of the past by having the right knowledge. So those online, I want you to do something for me. Just quickly type, say no to infertility and yes to fertility. It's not difficult. Say no to infertility and yes to fertility. That's what we are promoting here today, and that's what the MOM Fertility Clinic is bringing together today, for us to be aware that infertility can also you can get married at the age of 40 and still bask in the euphoria that you can have your kids healthy as possible, without having to fear, they say, menopause. Men will not pause. It can continue in your life as a woman if you have the right knowledge, and if you're privileged to be in this lecture hall. So we're going to take our next resource person. Our next resource person is Barrister Victoria Ojeabuo. She is a family law lawyer specializing in fertility law, surrogacy, and adoption. She's also a certified mediator and mental health counselor, offering legal clarity and emotional support to couples navigating fertility challenges. As co-founder of Mothers of Faith International Ministry, she provides spiritual and emotional care to women in waiting and expectant mothers. Through her work with the MOM Fertility Foundation, she champions accessible fertility support for undeserved families. Ladies and gentlemen, if your hands are not busy, if they are busy, please unbusy them. Put them together for Barrister Victoria Ojeabuo.
Good evening, everyone. It's a privilege to be here this evening. The first speaker, Dr. Charles Ojeabuo, he spoke extensively on your early 20s, your early 30s, how you should freeze your eggs. And then we have Dr. Gina emphasizing on your lifestyle changes, things you need to do, things you need to eliminate, things you need to put in perspective when trying to conceive. Okay? So I will be speaking about managing your emotional well-being during the IVF journey. For me, I get to meet a lot of women, a lot of couples, and when it comes to the IVF treatment, everybody thinks about the science, they think about medications, they think about the injections, but nobody asks them, how do you really feel? How are you feeling? There's a lot going on in the mind. There's a lot going on with your emotions. You can't step out of your house, and people are like, how now? Give that man a child now. Oh, when will our baby brother come now? There's always this emotional, can I say blackmail, It is not easy. And when we think about Africa, we are very cultural, very religious people, which is not bad. But we lean so much to the science, and nobody talks about the mental well-being of the couples trying to get pregnant. So today I'll be talking about how we can manage our emotions, our well-being during the IVF journey. So IVF journey can be emotionally draining, demanding for the couples who experience infertility. Bear in mind that infertility is a public health challenge right now. It's on the increase. If we look at ourselves as individuals, there's one person we know who is trying to get pregnant. Am I right? Somebody you know who is trying. Everyone has that person. So, but with all the mixture of the hope, the stress, the anxiety, and we experience sometimes disappointment, even when you have the money to pay for the treatment. But the biological clock doesn't just tick in our ovaries. It doesn't just deal with the male factor. It also ticks in our mind. How do you manage the stress? Not just the financial, the burden of not being able to get pregnant on your own, the financial stress also. There's so much to put in place. So in my session today, we'll talk about 3 things. We'll understand the emotional challenges of IVF and debunk some myths about IVF. We'll learn coping strategies to manage stress. And we'll also couples will learn how to strengthen emotional well-being through communication and self-care. So understanding the emotional challenges. Now, research has shown most couples who suffer infertility go through 2 major mental health disorders. Number 1, depression. Number 2, anxiety. Now, when I mean in fact, it starts with anxiety because you don't know, you're expecting, when will I see my next, I hope I miss my next menses. I hope, then you go home and you begin to feel the menstrual cramps. You're like, oh my God, I did everything. I took the medications. I took the injections. What has gone wrong? That alone, that feeling of uncertainty leads you into a deep anxiety, okay? Some anxiety happens because of maybe past experience with failed cycles. And then that patient could slowly lead to depression if they are not mentally prepared for the treatment. There's also a feeling of hopelessness, guilt, fear, because the couple will say, oh, it's not my fault, it's my wife's fault, it's not your fault, it's my fault. There's always that back and forth, So you feel that fear. Oh, if maybe the problem is coming from me, or maybe those are issues that could come up. But when you are mentally prepared for the treatment, it gives you a smooth sail all the way. So emotional challenges, post-traumatic stress following miscarriages, lack of self-confidence, aggression. This one. If you see a couple who is going through infertility, the level of, why did you keep your shoes here? You should have kept your shoe there. You begin to see those kind of conversations. On a good day, that is not an issue. But because she's going through what she's going through, there's a level of aggression. Inferiority complex. I always like to use myself as an example. Was I suffered secondary infertility. I'll go to church and I'll see the people we got married same time. They are having baby number 2, baby number 3, and I'm like, God. I'll just greet them and rush into my vehicle. That complex would always show, not because you are not happy about them, but these are some of the challenges with our mental health. You think sometimes you even experience rejection because you don't have children. These are some of the challenges. Now, there are some other physical challenges. You are just tired for no reason. You experience headaches. You experience digestive issues. And most annoyingly, insomnia. So let's debunk some of the myths of doing an IVF. I've met people who will say, I will never do IVF. I will have my baby naturally. I want to drop some of your fears, all right? Drop some of your fears and disabuse your mind. IVF babies gives abnormal babies. IVF gives abnormal babies. That's untrue. That is untrue, okay? IVF babies are natural, are not natural. That is also untrue. IVF babies do not carry parent genetic makeup. That is untrue. IVF injection cause health issues to mothers and the child later on in life. That is untrue. IVF needs 100% bed rest. Hello, you have to go out and make money. You don't need 100% bed rest. But however, there are phases where the doctor will tell you you need to be on bed rest, okay? So IVF pregnancies abort. That is also untrue. IVF babies are retards. That is a big, big fallacy. It's wrong, okay? So some of the coping strategies for emotional well-being. Reframe your relationship with time. Now, I don't want you, while you are going through your IVF treatment, you're saying, time is going. My biological clock is ticking. Oh, what will I do? Another year has come. We are in July. No. Reframe your relationship with time. Okay? Deep breathing exercises. I think we'll come back to the deep breathing exercises at the end of this so that we can practice it here. Okay? Mindfulness. Living in the now. Living in the now. There was a like a meme I saw about a child who was just sitting down and was playing in the field or something. And they said children are always happier. Why? Because they live in the present. They are not worried about, okay? So, and also, you must find time to relax and meditate. There must be meditation and there must be journaling. I think the second speaker, Dr. Gina, she mentioned journaling. Journaling is a key aspect of the IVF journey. I don't know how to take it out of the IVF journey. But I know that nowadays people don't really write in books anymore. But you can take your phone. Instead of you just scrolling through, social media, take out time and write how you feel. Write your emotions. You can also journal prayer points. You can journal affirmations, keeping you with the right frame of mind. All right? So meditation and journaling is also a key aspect of managing your emotions. Set realistic expectations. Focus on factors you can control. Know that it's not everything you can control. Am I lying? You cannot control the number of eggs, your AMH level, your semen parameters. Why don't you focus on your diet, exercise, all right? Eliminating harmful toxins from your diet. Exposing yourself to hazardous things. You can control those things and leave the rest to God to handle. Managing stress proactively. Example, engage in hobbies and exercises. This will help you also cope with the IVF treatment. The role of communication and support. Communication with your partner. You must communicate with your partner. I hear men say, how can I support my wife? I know she's the one going through the treatment. She's the one taking the injections. She's the one coming to the hospital all the time. She goes through the scans. Husbands, support your wife. I know a particular couple, each time the wife has an appointment, he is here. He is here. Some of our staff know them. He is here. He supports her, holds her hand, puts her make sure she's okay. And even if he can't be here, you see him making calls, wanting to be part of the consultation till she got pregnant and she had her set of twins. So you must communicate with your partner. You can cook for her. Yes, you can cook. Cook for her. If you can't cook, then you can get someone to assist her throughout during the treatment process, when she's going through undergoing the treatment. Show enough care. And if you aren't going to do anything, give her a hug and tell her, my darling wife, I'll be with you all through the journey. Okay? These words of affirmations from the spouse keeps the woman going. Even if she's willing to, even if she feels any iota of doubt in her heart, because she knows that her husband is just right by her side, he will be able to support her through the journey. So side effects of the IVF medications, women who go through IVF are extremely emotional. You will find her crying. Why are you crying? Even when you're not even going through IVF, you just happen to be pregnant, you find out that you just cry for all the awkward reasons because you can't eat bushmeat pepper soup or something. So you should, you should know that they cry for every reason. They get angry at any chance they get. So please be an understanding spouse. As husband, partners should give their wife hugs. Hugs are very therapeutic. Express concern, express fears, hope openly. Don't just say, I'm having it in my mind. These are things you should verbalize, okay? When and how to get support from loved ones. Family and friends can provide emotional and practical help. Think carefully think carefully who you want to share your journey with, and when and how you intend to inform them. Like in Africa, we have a very tight family, very close family ties. You hear, how far, you know what they are talking about. You hear your father-in-law say, how far, So you, as a couple, you must decide, when do I want to share that I am going through the treatment? Who do I want to share it with? Or you could just simply say, when I have good news, I'll get back to you. I don't want to be under any sort of, pressure. We hear a lot of, people say, oh, my in-laws are on my case, or, just because they want to show care. So you have to think carefully who you want to share it with. You have to think carefully when you want to share the news also. Attending functions like weddings, parties, baby namings, you may not feel up to it honestly, and it is not your fault. You need to let your spouse know, I may not be able to attend this family engagement. Oh, I may not go home for Christmas this year. It is all right to, want to take a step backward, because you need to be in the right frame of mind. Join a support group. Joining a support group is very important. We have one, the Mothers of Faith International Ministry. We support couples, majorly women anyway. Prayerfully, we join our faith with them, and we teach them God's word, letting them know that they can have their babies. And God has done it. Most of our members are pregnant, and some have already had their babies. So please join a support group. That's also whether online or in person. The 2 weeks wait after embryo transfer. These 2 weeks, they say, is the longest 2 weeks of any woman who is trying to get pregnant. It is the longest wait. So most women consider this the hardest part of the journey. Now you have done your embryo transfer. Everybody says, okay, go have bed rest. Don't avoid spicy food. They tell you all the do's and don'ts, and all of that. And you are waiting for these 2 weeks to get the pregnancy test done. You are feeling all the hormones because you are apparently still on some hormone medications. The progesterone is there, the HCG injections, everything you had, everything is just there. What do? You must stay calm, okay? Husbands should assist their wife physically and emotionally. Practice self-care. Now, when I say self-care, I don't mean that you must go to the spa, do things you really like to do. Prioritize your health. Go for walks. Eat well. Stay hydrated. Exercise moderately. Eat enough. Get enough rest. Fatigue worsens emotional distress. Engage in joyful activities. We heard that earlier. Spend time with your family. Spend time with your friends. Listen to good music. Music has a way of boosting up your mood. Consider professional help. See a fertility counselor or a therapist. And I'll let you know why you should embrace fertility counseling. Fertility counseling is an aspect of mental health counseling. Now, in this part of the world, fertility counseling is not really recognized, but according to international best practices, a woman who is going through the IVF treatment or any other form of ART, couples should go through counseling. All right? It is a structured support process that helps individuals or couples navigate emotionally, psychologically, relationally, ethically, and sometimes spiritual aspects of the fertility challenges, okay? So what happens, fertility counseling could be done one-on-one, it could be done as a group, all right? So the whole idea is just to serve as a support system for you while you go through the journey. Both partners are carried along. There are questions that the wife would ask and the husband is unaware of. But during the fertility counseling, both parties are carried along through the process. Fertility counseling also helps you to cope with the outcomes of the results. We know that IVF is not 100% guaranteed, all right? So there are stages of the fertility counseling. We have the pre-treatment stage. This is where the couples, they walk in, they make inquiry, and then we look at how we can assess you. We want to assess you mentally for anxiety, depression, your stress levels, using the right DMC tools, GAD-7 and PHQ-9. GAD is general anxiety disorder, and the PHQ just simply means patient health questionnaire. These questionnaires will help us know the severity of whatever mental health, your mental state, whether it's mild, whether it's medium, or whether it's severe, okay? And then we let you know some important factors, in your decision-making, in the decision-making process you may need to make. Informed consent, relationship with your family dynamics, yes, very important. And we set goals. Then the treatment stage, now you have started the treatment, now you have started to take your medications, now you are beginning to come for your scans, now the treatment has started proper. There are things you'll be going through. While you are going through that, you can still have access to your fertility counselor. Now, the fertility counseling, their patients are called the doctor. He doesn't even know what to say because he's not a trained mental health counselor. You've told him about your in-laws, you've told him about your husband, you've told him about all the challenges in the home front, and he doesn't know the right techniques to give you for you to come out of that stress you are going through. So the counseling unit is available so that you can vent, you can get coping strategies and come out of whatever you're going through. Now also we have the post-treatment stage of fertility counseling. At the post-treatment stage of the fertility counseling, whether the result comes out as positive or negative, you are being told what to do and what to expect throughout the pregnancy journey. We also have group counseling and support groups. All right. So the MOM Fertility Clinic is introducing an anxiety management and counseling session. It's now available on site and virtual. I thought you would clap. So we're introducing anxiety management and counseling sessions with couples who will be needing this service. All right. So you can call the numbers on the screen to book your session. For this meeting, if anyone is interested in the anxiety management and counseling session, we will ask you to fill out your name with the admin, and then we will get in touch with you on how. In fact, there will be a free, can I go back to the slide? There will be a free GAD screening, GAD-7 screening and PHQ screening also. Now, before we leave, there was something we're supposed to do, the breathing exercise. We talked about mindfulness. We talked about, So some of the breathing exercises you can do on your own when you are faced with some tough decisions to make. For instance, you go for your result review and the doctor tells you your AMH is low, you need to use a donor. Most women can't take that. Most couples can't take that. What do you do when you hear such things? So what do you do? Taking a deep breath. Or you go for a meeting and they are saying, where are the women that have children here? Instead of you to vent and lose control, what do? Let's look at the square breathing. The square breathing, you breathe in for 4 seconds, you hold it for 4 seconds, you breathe out for 4 seconds, and repeat the cycle for 4 minutes. All right? Are we ready to try that? If you are ready, say yeah. All right. So let's breathe in for 4 seconds. I want to see you breathe in. I will know if you are breathing in. So breathe in for 4 seconds. 1, 2, 3, 4. Hold it for 4 seconds. Hold it. 1, 2, 3, 4. Breathe out for 4 seconds. 1, 2, 3, 4. Fantastic. So that means many of us here, our lungs are active. Oh, that's good. So let's try the 4, 7, 8 breathing. This is going to be a bit harder. Breathe in for 4 seconds, you hold for 7 seconds, and breathe out for 8 seconds. And repeat the cycle for 4 minutes. Are we ready? If you're ready, say yeah, 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 yeah. All right, so breathe in for 4 seconds. 1, 2, 3, 4. Hold it for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Breathe out for 8 seconds. 1, 2, 3, 4, 5, 6, 7, 8. How do you feel? You feel good. Please give yourselves a round of applause. All right. So when undergoing the IVF treatment, you need to be in the right frame of mind. You need to spend time with yourself, love yourself, and know that everything is in God's hands. Thank you for your time.
Ladies and gentlemen, please, we can do better than that. We can do better than that. Yes. That's our own barrister. Somebody say the law. Say the law. Say the bar. We're going to go on a quick recess. We take this time out to exchange pleasantries, talk to your neighbor. So there was an event my grandfather went to at some point. He used to tell me the story when I was little. He said, the president of his time was seated very next to him, but till date, he never knew it was the person seated next to him because he never looked at the person or even asked for the person's name. So now, we're going to go on a quick recess. So ask of the name of the person seated close to you. Tell the person you look very good today. So while we are doing that, very quick, get to know the person you're seated next to. After that, we are going to bring Dr. Charles and Barrister Victoria to the podium. Well, let's go on this quick recess quickly. All right. So I'm sure you know the person seated very close to you now. Thank you very much, Ma. It's okay. Thank you. So one of the beautiful things about having a symposium and having a live audience and coming for a program like this is the opportunity to meet the person next to you because you don't know where you might see this person. Barrister Victoria took us in a very important topic, managing emotional well-being during the IVF journey. I'm sure by now we've already known the myths surrounding IVF are not correct. Saying that because the person had a child through IVF, that child is unhealthy. Is it correct? No. Exactly. Saying someone's child does not have the genetic representation of the parents because the person had the child through IVF. Is that correct? No. All right. So at this point, I want to bring to the stage Barrister Victoria, Dr. Charles for our question and answers. I cannot be bringing my barrister and the doctor and you're not putting your hands together, please. Put your hands together. While we are about to bring this symposium to a close with question and answers, please, we can still share the links. The fact that we will be bringing this symposium to does not mean the Fertility MOM Clinic is coming to a close. Always feel free to knock on the door for consultations. If you have any challenges, it's a live program. You have the opportunity to ask this question live. But once the live session is over, please, like the numbers we've been given earlier, please call those numbers or feel free to walk straight to the venue of the MOM Fertility Clinic. So we have a couple of questions here, Doctor, and I would like you to address. The first is the baby from the egg donor still biologically related to related children? I don't know who's going to take this. Let me go again. Is the baby from the egg donor still biologically related children?
Okay, if I got that question correctly, is the baby from an egg donor program biologically related to the mother that carried the pregnancy?
That's very correct, sir.
The DNA is coming from the egg donor. So there is no genetic correlation between the mother that gave birth and to the child that is born. So the baby will carry genetic information from the donor.
All right. So if we get this correctly now, that means when we have cases of egg donors, people donating their eggs for what we call it now, the case where people assist to carry the child for birth. That's the name we call it now. Surrogacy, yes. So that means through surrogacy now, the child is not related to the surrogate. Is that what you're saying, doctor?
Yeah, well, surrogacy is another concept entirely.
Okay.
Now, when you're talking about genetic relationship, you're talking about that the gamete, where the gamete is coming from, is where the child is genetically related to. So if, for instance, you have genetic father, genetic mother, whose sperm and egg was used, all right, and transferred to a surrogate, the baby will be carrying genetic information of the genetic father and the genetic mother, and will not get any genetic information from the surrogate, because the surrogate is just a carrier. It allows the child to grow and become born. But you can also have situations where traditional surrogacy, okay, where both the surrogate and the surrogate is the egg donor, which is something that is not practiced, is not encouraged, because for anonymity, you don't want the surrogate to have genetic connection to the child. So most surrogacy, and what we do is just gestational surrogacy, where the egg donor or the genetic mother's egg is used, okay, and it's later fertilized by either genetic father or a sperm donor, and the resultant embryo is transferred to a different individual called a surrogate.
Oh, great. All right, thank you very much, Dr. Charles. I think that has been well explained. It's very clear. I'm glad my wife is also here. She has been asking these questions over and over, because I'm not experienced in this field, so I have not been giving her the very correct answer. So the surrogates and the child are not genetically related, except the surrogate is the egg donor, if I'm correct, which is not even generally practiced. Great. Thank you very much, Dr. Charles. So the next question from one of our audience online is, what is the role of men in the IVF process and fertility health generally?
Well, I would say 100%. A woman cannot have a baby without the presence of a man. Okay? What the woman will only produce is the egg. So it takes the man to produce the semen, and the sperms are used to fertilize the egg. Then life begins. So the role of a man should be 100% in terms of support through the emotional journey of parenthood. I mean, if you ask me, at the end of the day, the child will even bear your name. So you should contribute 100% effort, both physically, financially, and emotionally.
Thank you very much, Dr. Charles. This question now. For how long can a woman's eggs be kept frozen? Let me take it again. For how long can a woman's eggs be kept frozen? You know, we said earlier that if you're approaching your 30s or you're in your 30s and there's uncertainties about you going into childbirth at the moment, or even spouse coming or anything, you can just go and freeze your eggs. And we even did a small exercise where we say, freeze your... How long can those eggs be kept frozen?
As long as you want.
2 years?
Yes. For as long as you want. So your eggs can be kept almost forever. As long as the conditions, the environment, the quality is good, and the liquid nitrogen is adequately checked, monitored, and ensure that it's optimal, those eggs can be as viable as whenever you need them, when they are thawed. So like we said, the earlier you do it, okay, the better. And of course, whenever you are thawing your eggs, maybe you froze them at the age of 30, and you are in your late 40s, let's say 48, those eggs, when you thaw them, they are still 30 years old, still viable and vibrant, and can lead to successful conception.
Oh, great. Thank you very much, Dr. Charles. So our last question from the online audience is, has there been any success rate for twins babies in IVF? And if someone wants to have twins, can they come here? So that's our last question from one of the online audience. Have you had any success rate for twins during the IVF process? And is it possible in this MOM Fertility Clinic?
A lot. In fact, we have a grace for twinning. Yeah, boys, girls. So through the use of assisted reproduction, like we said, a woman will ovulate once a month, but with IVF, we're able to get you to produce more than multiple eggs, which when fertilized will generate more embryos. So chance of having one embryo transferred or more is high. Okay? Yeah, there's a lot of regulations around single embryo transfer abroad, but we in Nigeria, we still don't have that legal framework to regulate our practice. But we tailor our practice after the European Society for Human Reproduction and Embryology, ESHRE. So we are able to transfer 1 to 2 embryos at a time, so that the chance of having multiple conceptions is high.
Thank you very much, Dr. Charles. One more time. Someone just quickly has been persistent. So, no, you can't take that as the last question. There's something she wants to also get clarified. She said, is there any option outside egg donor for a mother over 47 years old with low ovarian reserves?
Yes, science is evolving. There are approaches like ovarian rejuvenation, where platelet-rich plasma from the patient is prepared and instilled into the ovaries over a period of months. Okay, this helps to enhance the egg quality. So once the egg quality is improved in a way, the chance of having a viable egg, a matured egg, is there. But usually, because of genetic abnormalities which are associated from that age upwards, from 40 upwards, we usually recommend that before you do embryo of such an embryo from such a program into the woman's uterus, it's very important to do pre-implantation genetic screening of that embryo to rule out chromosomal abnormalities such as Down syndromes, Klinefelter syndromes, Edward-Patel syndromes, and so on and so forth, which can predispose that woman at that age to having abnormal child. You don't want to go through the process of IVF. You don't want to go through the waiting up to that age. Then you end up with an abnormal child. So it's better that the embryos are screened to be sure that they are healthy and normal before an embryo transfer is done. So science is evolving. Many options are being explored. People are taking some highly improved supplements now, like Dr. Gina emphasized. If you go back to the presentation, acupuncture, some traditional Chinese medicine, eating right, doing exercise, increasing the mitochondria of your eggs, avoiding sugars, all those things that she mentioned, they can actually help to improve the egg quality even after the age of 40. So I believe that this presentation has been able to help us carry people who are in their early, before 40, how they can preserve their fertility, and above 40, how they can also conserve what the amount of eggs that are left in their ovaries in the journey of parenthood.
All right, that is quite insightful, because there's been a lot of confusion with when we see women who are naturally above the age of 40 carry children, and then probably there has even been a recent Thanksgiving in my church, a woman above 50 having a child. Lots of rumors here and there, this one, that one, and all of that. But I'm glad. Audience and even people generally around the world that the age actually does not matter in the fertility journey. So far you do the right thing. Preserving your eggs is one of them, and then going for IVF and counseling is also another. So this question is for Barrister Victoria. So you said that there's a question that pregnancy induced emotional distress, mental disorder, is that managed here, and how can that be managed? Just briefly before we take the closing remark.
If I tell you how it's managed by trade secrets, what do you think so?
So it's managed here, right?
Yeah, we manage anxiety and depression.
Okay.
Yes, people who go through the phases of the IVF treatment, or even if it's the regular pregnancies and you're going through that phase in your journey, you manage them. Yeah.
Oh, great. Thank you very much. And to our live audience, you've seen, you've heard, you've listened to a very insightful lecture today from our resource person, Dr. Charles Ojeabuo, a fertility specialist who has helped over 2,000 women in their fertility journey. And through this program, we've also been able to help women around the globe have knowledge of what the fertility journey is all about. And not just him now, we have Barrister Victoria Ojeabuo as well, a mental health specialist and a consultant as well, who has also helped women in the journey of managing the emotional stress and well-being in the in vitro fertilization journey. Earlier as well, we had Dr. Gina talking to us about enhancing egg quality and fertility before your late 30s and 40s. So we're about to bring the program to a close, but I can't do that. I'd like to take the microphone back to Dr. Charles to give us a closing remark, a sum up of today's lecture and presentation, and then we take the third stanza of the national anthem as a closing prayer, and then we bring this program, this symposium, to a close. So over to Dr. Charles.
Thank you very much. I would like to especially thank our online audience and those who are here seated to make this occasion a success. I believe a lot of hope. Freezing their eggs. For those who are thinking of freezing their eggs, we offer that service, ovarian and oocyte cryopreservation. And for those who have clocked the age of 40, I also like you to know that there is still hope, and you can still have your biologically related offspring from the knowledge that Dr. Gina has shared with us. So all hope is not lost at every time, at every point where you find yourself in the biological clock. So thank you so much, and we'll be looking forward to hearing from you. If you would like to book an online consultation, please reach out to our social media. Reach out to us on social media handles. If you'd like to, we'd also like you to share the link, share to friends, family, and loved ones. And we will be having our next session in another quarter, towards the end of the year. We'll be having our A to Z of assisted conception regularly, and we'll still look forward to seeing you being a part of our sessions. Thank you.
All right. I also want to request your feedback. Feedback forms will be sent around so that you can give us feedback on how we can improve on the quality of information and the program we are bringing to you every quarter. We at MOM Fertility Clinic, we are very excited to do this because we know that we are an answer to many around the world, not just in Nigeria. We see ourselves as tools that God is using to put smiles on the faces of families all around the world. So if you're out there and you need to get your IVF treatment, please come in and book for your consultations with us, and you'll have a good time with us. I can assure you of that. Thank you.
Ladies and gentlemen, please let's put our hands together for Barrister Victoria Ojeabuo and Dr. Charles, and thanking every other person who came here today. And you know what you've heard today, what you've listened today, money cannot buy it. If money can buy it, you will pay through your nose, like I said earlier, to gain this information. And you know, it's always been for you to grow as an individual, knowledge is an important tool, and you've all now been commissioned as fertility ambassadors. Go spread the good news about fertility. No woman should have sleepless nights about infertility. No man should have sleepless nights about infertility without proper consultation. The MOM Fertility Clinic is always open 24 hours. Am I correct? Oh, great, 24 hours. You know, I know some fertility clinic have opening hours and closing. I just said that, but they confirmed that it's open 24 hours for consultation. So the program is going to come to an end, but then the fertility clinic remains. So ladies and gentlemen, if you are not too tired, I'd like us to be on our feet as we take the third stanza of the national anthem as our closing prayer, and then we'll see ourselves some other time again. It has been an interesting journey. My name is Ojeabuo Clement. They call me Mr. C of the capital, and it's been a great privilege hosting this event today. So if the media crew is ready for us, we're going to take the third stanza of the national anthem. So we're going to take that at the count of 3. 1, 2, 3, we go. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed. Say amen. Amen. Thank you very much.